Hello, I'm Laura Dierda, and this is the Becker's Health IT and Digital Health Spotlight. Today, I'm really excited to have with me Edwina Bhaskaran, who is the Chief Clinical Systems and Informatics Officer at Mayo Clinic. Edwina, it's a pleasure to have you here today. Thank you so much for your time.
Thank you for having me, Laura. Nice to speak with you today.
Absolutely. Well, I'm really looking forward to our conversation because I know there's so much happening at Mayo Clinic. Certainly, you are some of the most innovative health system in the country, and so it'll be exciting to learn from you. What's really top of mind for you and how you see things evolving over the next few years or so. But before we dig into the broader conversation, could you tell us just a little bit more about yourself and your background?
Sure, happy to. I have been with Mayo Clinic for 4 years. I am the inaugural Chief Clinical Systems and Informatics Officer. And oftentimes I get, well, what does that mean? That's really the amalgamation of a couple of different roles, but it really sits at the intersection of our technology, process, and people. And so I report up through our practice shield, supporting our practice in the adoption of technology, bringing technology to fruition in our enterprise practice, and making sure that we have the right tools and assets to advance our practice in healthcare as our delivery changes. So really fortunate to have this role. I have a front row seats to many of the innovation that comes through Mayo Clinic in supporting our core clinical systems like our EHR and other enterprise assets that we may have.
Well, that's amazing to hear. And it's so cool to have the inaugural role and be the first person to fill such an important topic, bridging the clinical as well as technology side. What have you learned over the past 4 years, and how have things changed for you, especially as you're the first person to have this type of role?
Yeah, that's an interesting question, Laura. I think the more things change, sometimes the more things stay the same. So some of the lessons that I've learned over my career continue to resonate. So things like involve your clinicians early and often continue to resonate in terms of, as we advance technology, as we introduce new technology, let's make sure that we have our clinicians in the forefront, driving that change, implementing that change. Cannot underestimate the importance of change management in terms of looking at both the people side of it as well as the process side of technology. And so really having that understanding of workflow, whether that's operational workflow or applicational workflow, those are some of the key lessons that I continue to relate to from perhaps different parts of my career as it manifests itself here at Mayo. Other than that, the technology is evolving in a rapid manner. So it's really exciting to see us where we're at. We're at an inflection point in many cases to think about the way technology will be able to shape both the way that we practice medicine, but also how our patients respond to the care that we're providing.
I love that. What a cool position to be in and to really impact so many patients' lives. Now, when you think about the last year or so, could you tell me about the most successful project or initiative, and what did you do? What were the results?
Yeah, I'm fortunate that at Mayo, we don't have a lack of these projects. We have so many that it's hard to pick one. I might perhaps spotlight one from a practitioner perspective, a clinician perspective, and maybe one from a patient perspective. So from a clinician documentation reduction perspective, ambient has really taken off for us here at Mayo Clinic. We are in looking at two products that both serve our providers as well as our nurses. And it's been interesting to watch the adoption of the tool, looking at the extraordinary response that we've had from our clinicians in terms of what they are sharing with us and how this has changed the way in which they're documenting. Our clinical documentation is pretty remarkable to see. I also think it's interesting to think through how the data is being used in terms of looking at the way we've documented for many, many years at this point, and thinking about, do we continue to document the way that we always have? So I think the ambient technology is really interesting. From a nursing perspective, we are co-developing with a partner, and that's very exciting to think about. How do we co-develop a product for nurses by nurses, and seeing the changes that we see, having front row seats again to being able to influence the development of a product by our frontline nurses is extremely exciting. I'll also share, just in terms of the overall impact that it's having. We're hearing a reduction in the number of clicks. We're hearing that it's easing their burden in terms of how long they're looking at the screens, and just the overall load, I think, in terms of that they face on a daily basis is lightening, which is good to see. From a patient perspective, we continue to make strides in personalization of their care, and data like genomics data and incorporating genomics data into the medical record is an extremely exciting place to be, and see how we can incorporate the data that's really about the patient into their medical record in new and novel ways is exciting. So seeing the personalization that's happening, having that data appear in their patient portal, having our patients interact with this new type of data and understand it in a way that's friendly to them has been something that we've been working on. And I only see that increasing over time as we continue to look at different data assets, different ways in which we're bringing in digital pathology, for instance, the genomics data that I've already mentioned, and the other clinical documentation tools.
That's amazing to hear. And certainly, what cool work you're able to do because you've got the data and the team that understands the technology, how to harness it, and then build upon, the platform so that you can really make a big difference for those patients. And I'm curious, as you mentioned, having, more of the clinicians involved in the process of putting these types of things together and creating the different, technologies and capabilities. What kind of energy is there around that from the clinical team? How do you get to a place where people are excited to be participating, as well as skeptical in the right ways?
Yeah, there's healthy skepticism which we encourage, because we want to incorporate that healthy skepticism into both the design, but also thinking through change management. So there is lots of excitement. I think when you have the discussions of we're developing something first of its kind, unique of its kind, here, not within some corporate office, but actually in the hallways of Mayo Clinic, it's extremely exciting to participate in. And seeing the excitement of our clinicians in the front lines to be participatory in that process is very exciting. It's getting your clinicians involved in an implementation to a whole new level. It's also teaching us how to participate in the various stages of product development and understanding what we might need to tweak, what's important, and seeing those just-in-time changes. So we're able to look and take feedback from our clinicians and incorporate those in a rather rapid manner so that they can see the benefits of their feedback right away, which is truly remarkable. You'll also find that I think from a clinician standpoint perspective, there's varying levels of excitement in terms of how they want to participate. And that's also exciting because you can identify those clinicians who you really want to incorporate their feedback because they're excited, they're energized by developing products, and that gives us a unique resource for us to not only look at this one technology, for instance, but also multiple technologies because they have the appetite. It's the next generation of super users, in my opinion.
Fantastic. Wow, a lot to look forward to. And, speaking about the future, I'm curious, given the success you've had over the last year or so in the projects and multiple projects and initiatives across Mayo Clinic, what do you see as coming up next over, the next 12 months or so? How are you thinking about things in the overall evolution of technology at Mayo?
Yeah, it comes down, Laura, to really the data, in my opinion. And so we now have new insights. We're continuing to glean insights about the data. And what I mean by that is we're able to really think about what data is valuable to the patient, into their care, and into their journey, if you will. And it's manifesting itself in AI, generative AI. And I hope that 3 to 5 years from now, we can take those lessons learned to help derive what actual data we need versus some of the extraneous data that we collect today. So I'm really hoping data will influence data. And so we're able to be in a better position of really streamlining the processes that we've accumulated over years and decades now to help inform what's truly defining and necessary for the patient. So I'm looking forward to that. I'm also looking forward to being able to reflect on kind of where we started with this journey and how it evolves with the introduction of AI and generative AI into practice in more expansive ways that we've been discussing over the last year or two, I would say, through generative AI and AI into practice. And so if I were to reflect maybe 20 years ago, or maybe even 30 years ago, how the journey has progressed with EHRs. The EHR that we implemented 20, 30 years ago isn't the EHR that we have today. And likewise, I'm really looking forward to seeing 3 to 5 years from now, what will our healthcare delivery look like, both from a healthcare provider perspective, but also as a patient and a mom and a caregiver to my parents. I think it'll be a very exciting time for all of us to see how this changes.
So many different capabilities, within the healthcare space and ways you can interact with the healthcare system is truly amazing. I know, Mayo Clinic based in Minnesota and has a variety of other campuses, but even my family in Iowa is very much connected with clinicians at Mayo and through telemedicine and all sorts of things. And so it's just so appreciated, all the work that you do with providers and patients and communities across the country. It seems like you reach so many different people in a variety of different ways, which is outstanding. Now, before we wrap up here, I'm curious, what do you think will be possible in 3 to 5 years from now because of technology within the healthcare space?
So I think you mentioned it a little bit. I think we're going to see more care at home. Looking forward to seeing different options for our patients that meets them where they need it, when they need it. Today, we are pretty prescriptive in terms of the type of care and how we interact with patients. But with the pandemic, we've been able to really push the envelope in terms of what we're able to do both virtually as well as in person when it makes sense. And so looking forward to seeing the expansion of that, the personal choice of the patient to determine what meets their needs. I think the other thing that I'm hoping as a result of that is also we as a healthcare community really put our patients' time of critical importance. And so they often work at our schedules. It would be lovely to see that change and shift. And so perhaps we can use some of the data that we've collected over time to be very precise of how much time do we need? How can we make sure that we're maximizing the time they have with us? Because time will continue to be a very precious commodity, both in terms of resources that we have within our healthcare organizations, but also for the patients in which we serve. So I'm looking forward to seeing some of those technology changes as well. I also think we will share more and more data with our patients and have our patients be more architects of their care as they continue to be informed of their care, as they're able to interact with data like genomics data, like data that is able to synthesize and educate them on their results, et cetera. So I'm looking forward to seeing that happen. Again, slightly biased because I'm a mom and daughter to elderly parents as well. So I'm hoping to see that for our future.
An amazing feature that would be, as a fellow mom and a person accountable for many different healthcare spaces, it makes such a big difference when you can have that convenience and trust within the providers that you're working with. So thank you so much, Edwina, for being here today. This has been really such a unique conversation, and I'm excited for you as well to speak at our Health IT, Digital Health, and Revenue Cycle event in October. This is going to be such an amazing time to explore so many of these different things in the way that clinical care is really changing in a meaningful way because of technology. So I'm looking forward to that and just really appreciate your time. I'm grateful that we were able to have this conversation.
Thank you, Laura. It was wonderful. Thank you.